Today we're going to be doing a neck lift, but to really get all of the loose skin of the neck. This is what I call the lateral approach and lateral extent. It is very similar to a facelift, and that skin is going to go back up behind the ear. So the incision is going to go up here. She does have a little crease over here. This is going to heal extremely well. Here we're addressing mostly this neck part. Sometimes I get a little bit of the jowl. This is not a major jowl treatment. This is what a neck lift is. A neck lift needs to take the extra skin out somewhere, and that somewhere is going to be behind here. We all know this muscle here. We all see it. That's the SCM, sternocleidomastoid muscle, but right in front of it, there's a thin sheet called the platysma muscle. And this platysma, we're going to separate it away. We're going to take it, we're going to bring it back, we're going to attach it nice and deep over here onto the mastoid so that we can get this nice contour underneath the jawline. We just finished up, and like I said, we made our incision down over here, submental crease, and that allowed us to get in here and anchor everything up, but all the extra skin as well as the platysma, we also anchored that back. And so the incision I stopped just over here because I did get a really nice pull up here of this jowl area, so you can see that. Of course, she's laying down and she's right after surgery, but we're going to see some really nice results. We're going to be doing a CO2 laser. This is the king of all lasers. It really addresses everything. So it's going to address a lot of this texturization, some of the pores, discoloration, some of the little vasculature, and it's going to make the skin just nicer and tighter. Typically nowadays, most of us are doing fractionated, faster healing. It's safer. We're going to be doing that throughout all of these areas. We're going to do the under eyes. A special note about the under eyes: if you go too hard under the eyes and you don't respect the fact that this skin is very thin, as well as the neck, you can burn those areas. And if you burn them, it's extremely difficult to nearly impossible to get that normal skin back. So safety is so important. I really can't stress it. We're here just 24 hours after. It's really kind of a lower facelift and a deep plane lateral neck. So when we want to really get that nice neck, as we were talking about yesterday, we go in through the middle, but we also do basically the inferior or lower portion of the facelift, where we start our incision right over here. We go back up around the ear, and exactly the same thing as the facelift. We still go into the deep plane. I kind of travel a little bit in the deep plane. This is only for very specific people. This is not for everybody. If you think it's going to give you a facelift, you need a full facelift. But we do get a little bit of this jawline, and we get just this really nice neck contour over here. So as you see, really there's actually no bruising at all. This purple is just kind of lines. You already see the contour of her neck. Obviously there's swelling. We went pretty mild moderate with the CO2 laser. So the following day, this is what you can expect. Some of the areas are kind of darkening over there. This is what we've got over here as far as the side view, and kind of all around the very next day.